Let's talk a bit about the different types of incontinence. After a prostatectomy, the most common type of incontinence men will experience is called stress incontinence. What stress incontinence is incontinence that will occur with exercise, coughing, sneezing, laughing, lifting, normal day-to-day activities. What happens here is that the sphincter has lost some of its closure pressure or tone. So when pressure is applied to the bladder pressure will override the sphincter pressure and cause leakage. Now, in the vast majority of patients that have undergone a prostatectomy, they may only have mild incontinence, may only use one or two pads a day, and they may only leak with, running or coughing really hard. But in some patients, unfortunately, their sphincter pressure is so low that the simple act of arising from a chair will cause leakage out of their urethra. As you can imagine, those patients are extremely distressed. They might be in a diaper, and they have what we call severe incontinence. There's help available and cures available for those patients as well. Urgency incontinence is the type of incontinence which occurs with a strong, compelling desire to urinate. This is common after radiation therapy. Essentially what's happening here is the bladder is spasming. It's squeezing inappropriately at the wrong time. So instead of you deciding it's the appropriate time to urinate, your bladder is telling you it's time to go, and the time to go is now. In those patients, often they can't make it to the bathroom on time due to the bladder spasming and urine being forced out. Oftentimes the amount of leakage you're experiencing can be a large amount, and oftentimes you may have similar symptoms of frequency, having to go to the bathroom very often, perhaps once an hour, perhaps more, as well as nocturia, which is the act of waking up more than one time a night to urinate. Help is available for patients with urgency incontinence and overactive bladder as well. Some men, after undergoing a prostatectomy, may leak during the process of intercourse. This can be stress incontinence induced simply from the act of having intercourse, but they also can experience a very distressing condition called climacturia, which is essentially ejaculation of urine. This often can be cured, however, with procedures to fix urinary incontinence, including the male sling and the artificial urinary sphincter.